Welcome to today's Explainer. We're diving right into a topic that, let's be honest, touches almost all of our lives in some way, whether that's directly or through someone we absolutely love. And yeah, breast cancer is a heavy, often really overwhelming subject. But our entire goal today is to strip away all that fear and replace it with solid, actionable facts. We're going to take a journey together, starting way zoomed out with some staggering global statistics. Then we'll drill down into the specific biology of the disease, and finally we'll land on highly actionable personal health steps that you can actually take. Because, knowledge is incredibly empowering. By the end of this explainer, you're going to have a really clear, structured understanding of exactly what we're facing, and more importantly, how we can fight it.
So, here is our roadmap for today. We'll start off with the global cancer burden, move right into understanding our risk factors, highlight the true power of early detection, explore modern treatment approaches, and wrap up with taking action today. Let's get into it. 2.3 million. Just take a second to let that number really sink in. That is the estimated number of women diagnosed with breast cancer globally in the year 2022 alone. It's a massive, almost hard-to-comprehend number, and it tells us right out of the gate that this isn't just an isolated issue. This is a top-tier, worldwide health priority.
All right, jumping into Section 1, the global cancer burden. It's a worldwide challenge, but as you'll see, it has some wildly disproportionate impacts. This table right here, it brilliantly and honestly heartbreakingly illustrates the stark contrast in survival depending on where you happen to live. In countries with a high Human Development Index, or HDI, 1 in 12 women will be diagnosed, but only 1 in 71 will actually die from the disease. Now contrast that with low HDI countries, way fewer women are actually diagnosed, about 1 in 27, but a staggering 1 in 48 will die from it. So what does this all mean? It highlights an absolutely critical global issue. Mortality is deeply, deeply tied to healthcare access, early detection, and comprehensive treatment.
Now, you might be thinking this is strictly a women's health issue. And while being female is definitely the absolute strongest risk factor, making up about 99% of all cases, breast cancer can and actually does affect men too. They account for roughly 0.5 to 1% of diagnoses. This means understanding breast health is vital knowledge for absolutely everyone, no exceptions.
Okay, let's shift gears to Section 2, understanding your risk factors. We're going to separate what we can't change from what we actually can. But before we talk about risk, let's briefly define what's actually happening on a cellular level. Think of it kind of like a glitch in the system. Breast cancer begins when abnormal cells, typically inside the milk ducts or the milk-producing lobules of the breast, just start growing completely out of control. If left unchecked, these cells can invade nearby breast tissue and create tumors. The real danger, though, is if these cells manage to reach the lymph nodes and metastasize, meaning they spread to other organs.
So, about 80% of breast cancers occur in women with no specific risk factors other than just being female and getting older. Those are your unchangeable risks. That category also includes genetics, like inherited BRCA1 and BRCA2 mutations, and your reproductive timeline, like early menstruation or late menopause, which basically extend your body's overall exposure to estrogen over a lifetime. But here is the empowering part. There are changeable risks. These are lifestyle factors you have direct, absolute agency over. Things like your diet, alcohol consumption, and the use of hormone therapies.
Let's dive a bit deeper into those changeable factors, because this is where you step into the driver's seat. Having your first child after age 30 or choosing not to breastfeed can slightly elevate your risk. Same goes for using birth control pills for over 10 years, or utilizing postmenopausal hormone therapy for over 5 years. And here's a big one. Consuming more than 1 alcoholic drink daily actually raises your estrogen levels, which fuels risk. Plus, postmenopausal obesity is a major factor, simply because excess fat tissue literally produces extra estrogen. Adjusting even a few of these specific habits can significantly lower your chances of developing the disease.
Moving on to Section 3, the power of early detection, because finding it early literally saves lives. It's kind of amazing to think that back in the late 1960s, the very first randomized controlled trials for mammography screening were just beginning in Western countries. It was a real game changer. Fast forward to today, and the clinical consensus gives us a very clear timeline. Between the ages of 20 and 40, an annual clinical breast exam and ultrasound are highly recommended. And the second you hit 40, that annual mammogram screening becomes the absolute gold standard. It's proven to drop mortality rates. Now, alongside those clinical screenings, your own physical awareness is absolutely critical. You've got to know the warning signs. We're talking about a new lump or a thickening, which actually is often
totally painless, by the way. Watch out for any changes in overall breast size or shape. Look closely for skin changes, like dimpling or this sort of orange peel, pitting texture, and pay close attention to your nipples. Any sudden change in appearance or an abnormal or bloody discharge is a definite red flag. Now, I want to emphasize this. Most breast lumps are not cancer, but spotting these specific physical changes is exactly why you must seek immediate medical evaluation if you see them. Better safe than sorry always.
All right, Section 4, Treatment, Mind and Body. Let's look at the holistic approach to healing.
If a diagnosis does occur, I want you to know that treating breast cancer today is not some solitary medical event. It truly takes a village. It requires an entire multidisciplinary team. Yes, of course, you have your oncologists, surgeons, radiologists, and pathologists handling the tumor itself, but a truly modern comprehensive care pathway that includes psychologists to support your mental health, dietitians to keep your body properly fueled through harsh treatments, and physical therapists to help restore your mobility, especially if lymph nodes are removed. It's all about treating the whole person, not just the disease.
And the actual treatments? They're no longer just a one-size-fits-all thing. They are incredibly personalized. Local treatments target the tumor directly. Think surgery like a lumpectomy or a mastectomy, often followed by radiation to prevent the cancer from recurring right there. Then we have systemic treatments, which are designed to travel through your entire body. If a tumor is fueled by hormones, what we call ER or PR positive, patients receive endocrine therapy. If the tumor is super aggressive or hormone negative, chemotherapy is usually brought in. And for cancers that overexpress specific proteins, we literally deploy targeted biological agents like HER2 treatments. Basically, the unique biology of the cancer dictates the exact weapon used to eradicate it.
Which brings us to our final section, Section 5, Taking Action Today. Let's talk about empowerment through self-care. Okay, let's get super practical. Performing a breast self-exam takes literally 10 minutes a month. The ideal time is about a week after your period when swelling is down, or just pick a set day each month if you're postmenopausal. First up, do a visual check in the mirror with your arms just resting down. Then, do it again with your hands locked behind your head. Finally, press your hands firmly on your hips, really flexing those chest muscles. You're looking for any asymmetry or weird skin changes. Next, move to a physical check in the shower. Using soapy, slippery fingers makes it way easier to feel any abnormalities. After that, repeat the physical check lying down. Pop a pillow under your shoulder to flatten the breast tissue out. And finally, just gently squeeze your nipples to check for any weird discharge. Boom. 10 minutes. Life-saving. And I want you to know the global health community is rallying behind this right alongside you. The World Health Organization's Global Breast Cancer Initiative has set a massive, ambitious goal for 2040 to reduce global breast cancer mortality by 2.5% every single year. If they pull this off, it will avert 2.5 million deaths. That is huge. They're out there fighting hard to strengthen health systems and expand care. But remember, at the end of the day, the very first line of defense is always your own personal vigilance. Which brings me right back to you. I want to leave you with this single, absolutely vital question. We've seen the global statistics, we know what our risk factors are, and we understand completely that early detection is the ultimate key to surviving and thriving. So take agency over your health today. Right now, check your calendar, call your doctor. When is your next screening? Thank you so much for joining me for this explainer. See you next time.